Hi, I'm Julia. I'm with the Power of the Patient Project, and we're here with Katrina Lewis from Drexel University. She's a nursing student, and we're going to ask her a few questions. Has the topic of patients' rights been discussed in your classes in nursing school?
Yes.
So to what extent?
A great extent, not just in the classroom. So we have an ethics class where we talk about the six most important ethic principles in nursing. So one of the big ones is autonomy, which is when we inform the patients to the greatest knowledge we have, and it's allowing them to make their own rights and not kind of forcing them to do what we want to do, but what they want to do.
Okay. Very interesting.
Yeah, also in our clinicals, a lot of our clinical professors are big on patients' rights, because a lot of the time I feel like it's easy as a nurse to just be oh, we have a big task list in front of us, give medicine or change IV tubing, and we can just get so focused on doing those tasks that we kind of push the patient to the side and we kind of just try to do the task. But I think it's important as a nurse to step back and actually listen to the patient, because sometimes you may catch things that the doctors don't catch, so then that can help with informing them so they can make their own choices. And I've been on the other side as a patient, and I feel like I've benefited when the nurses actually take the time to listen to me and they're not just there to give me meds or tell me what the doctor said. I really like when they let me make my own decision, because it's you're taking care of me, but it's still my decision because I'm the one who's with the illness. I'm the one who's going to have to deal with it after. So I think it's very important.
Right, I agree. As a future nurse, what are some of the things that are important to you in terms of honoring the rights of your patients?
Telling the truth. And I know that seems weird, oh, you should always tell the truth, but I feel like sometimes nurses or doctors, they can kind of fabricate or at least twist it a little bit to where you kind of lean towards what they want to do and not what you want to do. So I just think it's important to be flat out straight with them, so the patient can make the right choice that they want to do. Listening to the patient, because again, a lot of the times we're kind of just in and out the room, oh, I'm here to give you meds, or this is what the doctor said, and then we leave, and it's not enough time to actually ask questions if you have questions. So I feel like sometimes if you're not informed well, you can make the wrong decision, whereas if you just listen and take some time, they can actually get the questions asked. And it helps because you don't have to keep going back and forth with the doctor and calling about all these questions. If you just go in there and tell them everything, I think that helps.
I'm sure you've seen interactions between doctors and patients. In your opinion, what do you think can be done differently?
Okay, I have two things. One, doctors not sitting down at the bedside next to the patient and kind of just they'll come in with their team, but everyone's standing, kind of hovering over the patient, and sometimes I feel like that's intimidating, because it's who are all these people standing around me, and then I feel like they don't introduce everyone that's coming in, so then the patients kind of I feel like they're just backing them into a wall, and it's just intimidating, and I feel like sometimes they can go blank and not even ask the questions that they want to ask. And number two, the doctor just coming in and out. So they'll come in and then they'll tell them all the information, and then it's okay, thanks for listening, and then they'll just dash right out. I feel like if they just waited a couple seconds after the patient to give the patient time to ask something, because obviously when they're coming in giving information, they may not know everything that you're talking about. Sometimes I hear doctors use slang that they use with their medical team that the patient may not know what it stands for. So you're bombarding them with all this information, and then you're dashing out, and then they're not getting to ask what they want to ask. And then when the doctor leaves out, they're going to see their other patients and makes rounds. So then the patient's kind of stuck oh, when's the doctor coming back? I mean, they can ask the nurse to call, but from my experience, it takes a while to get the doctor back in the room. So then not only is the patient ill-informed, but now they're frustrated, and now they're going to be constantly on the nurse saying, I want the doctor back in, I want the doctor back in, which can be agitating, and then that just creates a whole other situation that could have been avoided if they just given a couple more seconds. I mean, I know they have a lot of patients to see, But I feel like what truly makes a good doctor is having that relationship with the patient to where they trust you. And I don't think it's wrong if you just pull up a seat, like we're talking now, pull up a seat next to the bed and at least come eye level with them like they're a person and not just like an object that we're studying.
Right, right. You brought up some great points. Thanks so much for interviewing with us.
No problem.
I'm Julia Ballarini. I'm with Power of the Patient Project, and we're with Katrina Lewis.